I am Tulani Bridgewater, and I want to welcome everyone who's joining us today to the Woolfer Live. I am here with Dr. Regina Edmond, who I must disclose is my doctor, but also someone who I very much love and respect. So I'm pleased to welcome her here. We're going to talk about all sorts of things related to women's health, and particularly in the sphere of gynecological and obstetric zones. So it's all going to be about, as I like to call it, the lady garden and all things. But welcome, Dr. Edmond. Thank you for coming, especially over the holidays.
Thank you so much for having me. It's such a treat to have a girl-to-girl talk about the things that we don't often talk about amongst ourselves, and neither in a larger forum like this. So I'm excited.
Absolutely. So first of all, before we start, I want to commend you, because when I was, you've been my doctor for years. But I did my research, but I didn't do my research more recently. And I went on, and you have a 5-star rating on Google. So congratulations to you, because that's not an easy feat. Because, if someone's got to say something nasty, they're going to say it, online. So for you to have such a high rating on the interwebs is pretty impressive. But also what I really love is that you also have modernized your practice. So I think that especially now with everyone being in quarantine and telemedicine being what it is, you were kind of a little bit ahead of the curve. You have a whole digital intake system, and we can look at our records and files, and everything's very transparent. And I know that as we go forward, and we don't know what's going to happen, that's probably going to be a little bit more of an engagement. And I'm wondering, how are you staying ahead of everything? And you really are staying ahead of just about everything.
I feel like it's one of the things that I've kind of had a tendency towards. I'm always observing what they're saying in the media, what they're kind of alluding to, but not directly saying. And those are the things I lean into. I say, okay, so they're kind of whispering about this. Let's do a little investigation. So when it came to starting electronic health records back in, it was 2013 when I started, and I was in like 1%, and everyone would come and tell me, what is this computer business? I don't like it. And then all of a sudden it got better and better. And then everybody was like, yes, this is the most convenient, most amazing thing ever, after everyone got adjusted to it. And so that's what I've done. And even in the face of the challenges that we've had in 2020 with COVID, when they pulled all the kids out of school and they shut everything down, I said, so what's going to be the best way? How can we continue to take care of the women that actually need to be seen? And I said, okay, so we need to make sure they're not sick. So we screen them, ask them the pertinent questions, take their temperature. And then as things continue to evolve, it was like, okay, now we need to wear gowns and certain types of masks. And we evolved with it as it transpired. So, yeah.
Well, and I can say that because of my confidence in you, because you've always been very, very straightforward, which I really appreciate, because I think that there's a tendency, especially when it comes to the medical field and its treatment of women, that we sometimes are not given the benefit of intelligence or the ability to emotionally onboard relevant information about ourselves.
Sure.
But you've always been really great about that. And so you're, aside from me having to see other doctors because I had like a medical thing, you're the only physician that I've seen in quarantine. Wow. Not only because I have to see you because I need to make sure that all of my parts are functioning properly, but also because I know that you're going to be, sensitive and judicious about everything that's going on with quarantine. But so beyond that, I wanted to talk to you. I mean, obviously, the Woolfer is a community that's for women 40 and over. So we're all hitting perimenopause, we're hitting menopause. And I know when I started all of that, first of all, I had a hysterectomy, which, hello world, I had a hysterectomy. And you came on as my physician shortly after that, and you managed to kind of shepherd me through the whole process. I didn't lose my mind. I didn't go through a radical hormonal shift. And, it's something that you've monitored. But I think with a lot of women who start hitting this age and we start having these sorts of issues, we don't really know what to expect. So can you maybe touch on aging in general?
Sure. And I first want to start off by, a lot of aging is how we perceive ourselves as we mature. Some women in their 30s even feel like, oh my God, I'm so old. And so a little bit of aging has to do with how we think. And so if we think that we're going to be able to get through it, oftentimes we have a better outlook on how we approach the changes that are happening. So yes, 40s is a whole new ball game. So for those of you that are kind of right at the cusp, get ready, put your seatbelts on, because what happens is not only are our hormones, they take a change that is more extreme. Usually when we're in our 30s and 20s, we have a period and it just rolls on and you may not even notice that it's happening. In the 40s, it's like, wait, the whole world kind of stops. The flow
Yeah.
may be heavier. It could skip. It doesn't follow the same pattern as when you were younger. And along with that come the emotions. Because the hormones are changing, our emotions are changing. And along with the emotions, our minds are changing. So the way we process information, the way we retain information, our ability to focus is all impacted by those subtle hormone changes that takes a little bit of sensitivity to respond to. And so that's why I advocate for women to see women so that they get that common language and common understanding of what may be happening as we mature. So that's sort of the
Yeah.
beginning of the change. Go ahead.
So I'm wondering, so I have so many questions for you. The first is obviously as relates to on the patient side. There's a lot of mystery, it seems, still surrounding women's reproductive health.
Sure.
I mean, we've learned in the Woolfer, we had someone come on and explain to us, what the reproductive system actually looks like, because there hasn't been a lot of investigation into anything beyond making babies. And
Sure.
really, it's kind of like, okay, you make the baby, you birth the baby, you send the baby out into the universe, and then we're like, the world's kind of like done with
And then
it. Like,
you just go away
yeah,
and live.
please go away. Please go, you old crone.
Oh, bless it.
Go get your elasticized pants and just leave us all alone. And by the way, I love elasticized pants. But there's this whole other universe that women inhabit, and so what I've always found very curious and frustrating is that we're treated like these mysterious creatures, and yet we're literally half of the population, and the population is to perpetuate. I know test tubes, IVF, and all that, but still, until they figure out how to gestate a human without a woman's womb, and I should say woman, all-inclusive, people with uteruses. Why is this so mysterious? I mean, it's critical. What is that about? And I know there's some systemic sexism in play. I know that, but
well, I think it has, as women are now becoming more empowered, B, becoming educated in the medical field, we now are more encompass the admissions in medical school more so than men. So that's part of the transition into demystifying women's health, women's care, because now it's being managed by us for us. And so now we get to prioritize the things that had been underemphasized, underreported, not even discussed. And so I think this is a perfect time for us to just dive right in. What is it that we need to know about? What hasn't been discussed? And if I might take the floor, there is a whole new world that I didn't talk about in aging women with the pelvis. So in your prior conversation, you talked about what the organs look like, which is critical, right? To even knowing when something hurts, what organ might be affected, so that it can either calm you or, have you seek the right kind of care at the right time. But for those women who may have had children, may have had an abdominal surgery. Oh my goodness, I thought I had silenced this. I apologize.
Someone having birth. If they're giving birth, take a call.
No. It's on Do Not Disturb. Now I apologize. So if you've had a baby, had abdominal surgery, have a sedentary lifestyle, work at an office, sitting, all of these things start to affect the muscles in your pelvis. And again, it's not until you get into your 40s that it becomes an issue. And it can show up in so many different ways. It can show up as sometimes leaking when you're trying to hold it and you can't quite hold it to get to the bathroom in time. And it's like, then you have a little leak there. Or you're having pain during intercourse or during orgasm, all because those muscles in your lower pelvis are either contracted too much, and then others that should be stronger are now too weak. So had a mind-blowing experience, and I'm going to share something personal because it was so informative and hopefully it will help someone. Pelvic physical therapy. I was
Oh,
having some discomfort. I said, well, who better to go to than someone who understands the muscles and the nerves in the pelvis? And so I had an entire education. Now, I was proficient in anatomy. I was so proficient that I taught medical school anatomy while I was a medical student. And so I understand the anatomy. I'm a surgeon, I operate, but I really didn't understand how everything fit together and can contribute to symptoms. So, long story short, she checked all the muscles down there and was like, these are tight. And I thought the whole time I was having pain because something was weak or loose. Everything she tested, this is tight, that's tight, you need to stretch, you need to do this. And I said, wow. And after having a baby, which I have, all of these things changed to a new norm. And I said at the end of it, I said, every woman who's had a baby needs an assessment in this way, whether they're functioning completely normally or they're having some kind of issue. It was extremely informative.
so then my follow-up question would be, so when a person is going to see their gynecologist, these are conversations that we don't even know we need to have. I
Sure.
would never think, oh, can I talk to you about my pelvic floor health, or should I
Sure.
be doing any pelvic? I mean, I've heard of Kegels, of course, but that's more presented as like, for sexual pleasure than anything else. So adding on to your pelvic health, and I never heard of pelvic therapy. I mean, is that like something that you use a device for, or these exercises that you do?
It's all of the above. It's all
Okay.
of the above, right? So, and it encompasses so many different avenues. If your hips are tight, if it hurts on your sits bones when you sit down, or I mean, she just gave me a wealth of information during our conversation and assessment that that would have far-reaching implications for patients that have any kind of pain or tightness or restriction. I'll broaden it even in the
Okay.
pelvic area, any space between those two hip bones. Yeah.
Interesting. So then I have another question for you. There seems to be a lack of information about things like fibroids. And a lot of women in our community struggle with fibroids, they struggle with endometriosis, and these things seem to exacerbate with age. What is the deal with, it's such a prevalent issue, and yet it seems like it's only really been in the past 10 years that we've heard a lot about it.
Sure. One of the reasons why you're hearing more about it now is because of the commercials. There's a really powerful endometriosis commercial out there that says, if it hurts, tell your doctor and tell them how much it hurts so that they can understand that you really need some attention. I thought that was a very good commercial that allows women to feel comfortable and empowered enough to ask for a solution for something that they've probably normalized and taken over-the-counter pain medication for years and years and years, and not really understanding that there is a solution that can improve their quality of life. And in terms of fibroids, well known, affecting lots of women, predominantly women of color, and it's very far reaching. I mean, fortunately now though, with technology, new instruments, new approaches for taking care of fibroids, women don't have to lose their uteruses. And I think that's key. In the past, maybe 40 years ago, women would just, oh, you have fibroids, oh, take out your uterus. But now that it doesn't have to be that way. Yeah. Well, sometimes, and not to say that you didn't need that, because there's plenty of times when we do remove the uterus. So, yeah.
What's funny about, and to just touch on the hysterectomy issue, it's something that I never really, I mean, mine had to come out, just so we're clear. Like, the shop was failing, it was dilapidated, it needed to go, it was dangerous, it was a fire hazard for everyone. But what I didn't realize is that not only did I have a physical issue, and all surgeries are much more difficult, I think, than we anticipate. Even the easier surgeries can be very challenging, not only physically, but also, there's an emotional element that goes along with it. And I think when you touch upon your reproductive organs, also, it starts to call into question a lot of identity issues for many uterus havers. And I remember I joined a forum I think it's called Hyster Sisters, which is such an unfortunate name, but it was really helpful because it allowed me to grieve the end of my reproductive life. And I think that was kind of an acute example of what women go through as we age, is that you start to have to re-identify yourself. I don't think we realize how much our identities are couched in this reproductive phase of life because it's so emphasized.
Yeah, I completely agree with that. And having you bring that to my attention, it's something that I discuss with patients who are very emotional when I'm having the pre-surgery conversation with them, and they're very tearful. Then we go into the loss aspect. But for those who seem very resolved about it, understand the benefits that are going to be had by removing it, honestly, it isn't something that I address. But now that you're bringing it to my attention, it's like, maybe we should offer a resource for those who may have difficulties after removal.
Right. I'm like super, well, you know me, I'm a bit of a stoic. I mean, I'm a wise ass and I'm stoic.
Sure.
So it could be. But so moving away from that, vaginal rejuvenation, because of vaginal atrophy, is something that comes up a lot in our community. And it's one of those, excuse me, what? Things that a lot of women confront. Sure. And it's like all of a sudden, there's this issue that many of us would never have even thought about, but it radically affects your sexual life.
Sure.
And I've talked to several members in the community who've had some pretty severe issues with it. And I'm wondering, is there any ways to stave this off? Is there any way we can kind of get it in front of this, or is this just something personal? We just have to look out for it.
It's a timing thing. So I think the longer you wait, so the changes, again, here we are at the 40s, right? Those changes all start to happen in the 40s. And it may show up as, a little dryness during intercourse, a little leak here. If we address it at that time, you can prevent the worsening of the situation where it becomes much more difficult to improve. Now, vaginal rejuvenation comes in a few different forms, right? There's an extensive surgical form where you actually manually tighten that vagina, cut it, close it up, and make it the size you want it, which takes 6 weeks to heal from. Not something that I do, but it is a cosmetic procedure that is done. Then there's the type that for, I think, like a maintenance, right? So as you approach that place, you're noticing changes, it's time to get started with your vaginal rejuvenation. And I use that rejuvenation term a little loosely. I call it vaginal enhancement, right? To help bring you back and help you maintain that more youthful state of the vagina. And the procedure that we use in our office is called Mona Lisa. And what that does is it helps to improve the moisture balance, improve collagen and elastin in the area, so that the vagina continues to function in a youthful way, and helps to improve some of the leakage, depending on the source of the leakage. If it's a leak related to the change in the thickness of that tissue, then rethickening it can improve that leakage problem.
Okay.
Yeah.
So this is pretty interesting. Now, I know that there was a lot of press, I think it was about a year or two ago, about the, I think they called it the husband stitch that many women receive after giving birth to tighten, but that's just tightening the actual opening of the vagina. That's not tightening the vagina itself, correct?
Mm-hmm.
Okay.
Correct.
Yeah, that's a whole minefield. We're not even going to get into that.
Well, under my care, after having a baby, my goal is to put you back to the way you were in the beginning, right? So as close to as possible as we can, we put it back together. Yeah.
And then as women are starting to have children older, we have several women in our community who just had babies, and oftentimes they're first. Obviously, we've all been told that having a child after you've turned 40, you're higher risk, and so on and so forth. But the body also responds, I would imagine, a little bit differently. So have you noticed anything as we're like delaying having kids, or maybe we're having our surprise baby, or, what's
Sure.
going on?
So one of the things that happens most often is that medical issues become an issue.
Mm,
Things like diabetes or high blood pressure become really at the forefront in terms of managing the pregnancy, co-managing it. And those things can play out in terms of how baby grows inside and how we end up having to deliver this baby. So it isn't as automatic or assumed that everything will just be 1, 2, 3 after you reach 40 or
yeah.
beyond.
I have a sister who had her first after 40, and every hat I could take off to her, I take off, because it was wicked in my 30s. I can't even imagine.
Sure.
I cannot even imagine.
Not to
So,
mention the joints and the hips and your body's response to the weight changes and the fluid changes, because as many women may know, during pregnancy, you have to gain more blood. And so you're dealing with swelling and extra everything, and your
yeah,
body just handles it very differently after 40.
yeah, I can imagine. So as we're transitioning through, we've talked about the 40s, but as we get older, because we have women in our community who are in their 70s and 80s, what are the things that we should be mindful of? Because I feel like we just don't know what to look for.
Sure, sure. So after 70, so the things that are important is attention to nutrition, attention to health. So how are we taking care of our bodies? What kind of nutrients are we putting in? And then mobility, right? In order to stay mobile, you have to be mobile. That's sort of my personal philosophy. And so if you don't have a movement routine, and I tell this to my 20-year-olds, but to create a movement routine that will last you throughout your life is one of the keys to longevity. And so even if you're limited in some way, if your joints are already giving you concerns or you're having decreased mobility, you can still do some form of activity that keeps your heart and your lungs strong and keeps you vital as you mature through the 70s and 80s.
And then is there anything in particular that women of color need to be aware of as far as our reproductive health or the motion through the transition from when?
Sure. So if we think about African American women, there's sometimes an issue with access, and I think if we are taking that time, because many of us are busy and we're raising children and we're putting ourselves last, I think that goes across the board for women who are parents as well. But taking that time and making sure that you go to the doctor, do those annual exams, they're critical. Even if you always get a normal result, it's still the reassurance that you need so that if you are delaying your childbearing into your late 30s, early 40s, you've maintained a good relationship with your gynecologists and they've directed you. One of the things that I do for moms who are deliberately choosing to delay childbearing is to consider egg freezing, because we know after 40, the chances of you getting pregnant spontaneously are very low. And so if you have younger eggs, and I know that's not something that women in their 20s and 30s are thinking about, but if you have those younger eggs, that changes your outcome tremendously. And so that's one great way to maintain your fertility as you mature.
I remember when I was told that my eggs were older, I was like, excuse what? I didn't even realize that was a thing. Kind of been too late. So, okay, so then going to the very beginning, how soon, a lot of us have daughters, at what age should we start bringing our daughters in to see you?
So if our young ladies are having, and it can be as young as 13, 14, right? So here are the caveats. If they're having irregular periods, or if they're having periods that are really heavy and they're not able to do their activities, their athletics, their PE classes, that's a reason to see me. If they're having any breast disorders, like something's happening, I feel something, it's not quite right, have her come in. If everything is normal, so let's say you have a great kid, she's not interested in boys and she doesn't have a boyfriend, wait until high school year, senior year, before she goes off to college. We have a broad conversation about risk behaviors, birth control, and just have a blatant conversation. If she's not ready for birth control, if she doesn't think she's gonna, be talking to boys, and that's fine. I base it on where she is emotionally, really. If she's already thinking about having a boyfriend, then we start talking about birth control so that we have her protected as she goes out there.
Which makes perfect sense. But I think that it's really nice to have these conversations openly and without drama attached to them.
Absolutely. And while I'm very sensitive because I'm a parent of a teenager, and it's very scary. And so I have the moms come in if the daughter wants her mother, because I respect the fact that she might not want her mom in there.
Yeah.
And so if she chooses not to, then mom's not there. But if mom is there, I feel mom's energy too. Is mom very anxious about talking about birth control? And then I bring them both to the same page so that mom understands that this isn't permission for her to go ahead and be active, but more so a preventative, a protection, insurance, a security.
And then you can choose not to answer this question. I don't want to put you on the spot, but HPV vaccines, huge talk about them. Some people are very, are advocating for them. Some people are very much against them. If you have an opinion that you'd like to share, I'd love to hear it. If not, you can simply say, let's move along.
I talk about HPV almost every day in my practice.
Okay.
HPV can lead to cervical cancer if left undetected, not treated, all those things. So I am a huge advocate for HPV vaccine. Why?
Okay.
Because this current vaccine, which came out 5 years ago, more or less, covers nine types of HPV. The top 9 that can most of the ones that cause cervical cancer. It also covers a couple that protect from genital warts, but the types that protect from cervical cancer are crucial. I mean, it changes the course of a woman's pap smear gynecology visits tremendously. And so for that reason, I think it's very valuable.
Okay.
Very valuable.
Thank you for that.
And then affects up to 80% of patients in their reproductive life HPV. So if you don't get the vaccine. Yeah.
It's crazy because I feel like it wasn't, I mean, I don't know, maybe I'm ignorant of, I am ignorant of a lot of things. And by the way, the first step to learning anything is knowing that you know very little. But it does feel like it was only in the past 15 to 20 years that the HPV conversation really started coming to the fore and people started discussing it. And it was just kind of mysteriously in this, cervical cancer, oh, that's really sad category, as opposed to something that might even be preventable. So to me, it was a tremendous relief. I mean, it skipped me. It's not as much a concern, but for the younger women.
But what I think that's beautiful now, the trends that are happening is that we're vaccinating the males also. So now we have an even greater chance, and it's not going to be seen until our children's generation becomes sexually active. We won't be able to see how that really affects the onset or the incidence of HPV and the precancer and cervical cancer. So more to come. Very encouraging, though.
That was an interesting conversation that I got to have with both my son and daughter, and they actually both elected to be vaccinated at a very young age. So either they're insane or they're smarter than I possibly could have raised them, which is wonderful. So, okay, let's step away from like all of the work stuff. How are you doing? How are you doing in quarantine? How is your daughter doing?
It's a loaded question, Tulani. Yeah. Having a teenager who's very used to being social, and having to tell her in March to bring home all your books with the intention of thinking this would be a semester. You'll go back in the fall, to then have to look her in the eye and go, I don't know when you're going back.
Yeah.
It's very challenging for a parent, any parent who's invested in their children, and to see her just become more and more reclusive and in her room is just, I think that's the hardest part of dealing with COVID. But the second hardest part is actually having to leave my house when they say stay home. And I'm like, I have to go. Bye.
Right. I mean, you are essential. So have you received your vaccine, your COVID vaccine yet?
I'm going. Yes, I'm going. It's ready. Okay. I just got to go do it.
Oh,
Yeah, yeah.
well, I mean, I'm grateful because I want to keep you healthy forever.
Excited. I'm excited because this is going to be our way to get back. This is our way to get our lives back on track. And, you know, if this is what it takes, we have to get one, and then 6 months later, get a second.
Yeah.
And I'm
Oh,
all for it.
I want my life back. I now feel very, very, very in touch with how animals in captivity must feel. I don't know that I'll ever go to another zoo because, oh my God.
Wow, you're so, like, you get it. You
Oh, I
get it.
get it. I get it. And I've worked from home for 20 years, and I keep trying to explain to people, this is not work from home. This is something completely different. When you work from home, it's a choice. When you're working in quarantine, it's no longer a choice. It's a necessity, it's a requirement, but it's also a completely synthetic reality. There's nothing about this that's normal. This is totally artificial and bizarre. That said, I don't know if you feel the same way. I have deep gratitude for being able to spend this much time with my family in such a meaningful way. And surprisingly, once we got through the first few months, no one's trying to, pull anyone's hair out, and we're all really getting along beautifully. So that's the side benefit. It could have gone a different way though. It really could.
Sure. Absolutely. Yeah, I think for our family, the first few months was quite refreshing. It was refreshing. We exercised as a family. We realized we had neighbors and they were outside exercising too at the same time. So we had conversations with neighbors and we saw them and we waved and we were talking. It was all very organically human. I loved
Yeah,
it. And then
yeah,
as it wore on and July came and went, and then it just kind of spiraled a little bit south. And from my perspective, because there's one thing to be patient with a deadline or a end point.
yeah.
Then there's another thing entirely to wear on and on and on with, yes, now that we have the vaccine, there's sort of an end point in sight. However, maybe
Yeah.
summer, how long will it take to get the vaccine out to all the people?
I'm fingers crossed. And for anyone who's watching, we're in Los Angeles, so we're not doing so great out here with our numbers, but we'll get better. It'll all improve.
Yeah.
So I guess before I let you go, because I know that you are at work, are there anything that you feel like we should all know, we should all think about, or or not? You feel like we covered it? I mean, you could talk, I'm sure, for days.
Stress management.
Oh,
Can we all just take a moment to plant our feet on the grounds and just like take a deep breath? And remember that we as women are the center of our households in many cases. And we're dependent on for so much. But just to remember that we are ourselves, we're here in the midst of it all as feeling, thinking humans. And we have to remember that and put ourselves first. Like they say in the airplane, put your mask on yourself before you put it on another person. And I think if we remember that, then we're off to a good start, because then we're able to remember that we're empowered. Our feelings matter. Our questions, our concerns matter. And then we're able to make good choices for ourselves and our families.
oh, thank you. And
You're
yes,
welcome.
oh,
You're
thank
welcome.
you so much for spending some time with us today. I look forward to seeing you in person, when the need arises. But otherwise, you're just the best. You're absolutely
Awesome.
the best.
Yes, it was a great joy. Thank you so much, Tulani. I hope someone got something from this. And
Definitely. So everyone, this is Dr. Regina Edmond here in Los Angeles. You can find her online and see more at the Woolfer. And